question on the health services is 2.5 million, 2.6 basically, and license and fees is 2.1 million. That just seems like odd numbers together there. It's health services, what you provided, and it seems like an awful lot for licenses and fees.
Yes, those are both revenue incomes. So for license and fees for FY24, that is budgeted to be 1.8, almost 1.9 million, and then health services almost 1.4 million for FY24. License and fees is those come from, for example, our environmental health services when we do septic tank approvals, and when we do restaurant permit fees and others. But those two things represent most of those. That, of course, if you look at FY23, that's quite a bit more than what we're proposing in FY24. We're not expecting the same growth in real estate that we saw in FY23. FY24, that's a significant decrease in our budget from FY23 to FY24 of over 1.2 million. That's largely due to the loss of home health. And also we were expecting a decreased use of our clinical services in FY24.
Anybody else have any questions? Okay, well, I got a question. Because you asked 5 counties, well, actually you don't ask the 5 counties for funding, we're kind of forced to fund it. But I want to ask some questions about all-cause mortality and the behavior of the health district statewide, especially Panhandle Health District, since it's our neighborhood and our families that are affected by it. Everybody jumped on board during the pandemic years and pushed the vaccines, knowing that there was a tremendous amount of unanswered questions about it. There was a lot of science out there that existed that the medical world seemed to refuse to acknowledge. Dr. Farsi would get out there and represent the CDC and throw out all these guidelines for us that made absolutely no sense. And the medical professionals that I talked to and the research that I did found that they were lying to us. And they've been lying to us for over 3 years now. And I want to know why the Panhandle Health District ignored all-cause mortality when we've got these hundreds of thousands of people that are dying. And it's not because of COVID. What's it from? And the only common factor that connects to it is the vaccination. And so if Panhandle Health District is going to push forward CDC guidelines, I want to know how many people in this room followed those CDC guidelines and got a vaccine and 5 boosters. If you got a vaccine and at least 5 boosters, raise your hand. Because if you followed the CDC guidelines, you'd have 7 boosters. So you've pushed forward an agenda that you yourself did not follow. You took a Hippocratic oath as a doctor. Has it become a hypocritic oath? You have lied to the public, Don Duffy, and you have lied to us.
What was the guideline?
That you should have a vaccine, and by now you should have at least 7 boosters.
No, did Panhandle Health embrace that? I don't think you did you?
They pushed it.
Well, that's a big question. It really is a big question, and the amount of data that came out on the pros and cons of the COVID-19 vaccine was extensive. Yes, there was data that came out that suggested against it, for sure. There was a lot of data, quality data, peer-reviewed data that was very clear on the benefits of the COVID-19 vaccine. to say that I am in the pocket of the CDC would be an error.
I didn't say you were.
That you and I have chatted about this before, that I still hold the same truth feeling that I did as when this whole miserable pandemic started. And that is that we teach people correct principles and let them govern themselves. That has been my stance as the director and continues to be the stance. We will gather the best data that we can, but it is up to the individual. Just like you made a decision based on the data that you gathered, you didn't feel the need to be vaccinated. And I can't tell you how much I respect that. That level of free agency is what we promote. Saying that, I would not take away the opportunity for someone to be vaccinated if they wish to do so based on the research that they were to do regarding the vaccine. And we're hoping that research, we're hoping that it always happens that they're checking with their own providers of whether or not they should be vaccinated. Yes, we did provide opportunities for people to be vaccinated throughout the 5 counties. And honestly, Commissioner, I'm proud of those efforts. But to say that somehow we forced them or that we pushed an agenda upon them, that has not been my position from the start of this pandemic. And that's my answer to your question.
Well, there's another vaccine that's going to roll out here this summer that's for expecting mothers. Where's Panhandle Health District going to stand on that? But before you answer, I want you to understand something. In Matthew 18:6 and Luke 17:1-2, and probably at least a dozen other places in the Bible, it says, for one to harm a child, it would be better that that person were thrown into the sea with a millstone tied around their neck. So, this is something that my dad told me years ago, and it's actually in the Bible. A man comes to a point in his life where he gets to make a decision, where he knows without reservation what is right and what is wrong. And he gets to choose how he goes forward with that decision. Even if it means that there's certain repercussions and sacrifices that'll happen if I choose to do what is right, for me not to do that would make me a deplorable and despicable human being, especially if I know what is right. And so, without reservation, the health community knew from the onset of the COVID. It was not in question. They knew. Beyond a doubt, they knew what the repercussions of that vaccine would be. Not only has it caused an onset of massive amounts of death, we're at way above a Cigna 4 event. A Cigna 4 event would be similar to World War II death in that period of time. We are way past that just in the COVID years and approaching, and that does not take in the fact of how many people are suffering disablement, disabilities, long-term problems that were brought on by the vaccine. And the CDC knew that, the medical field knew that, but I'm going to explain to you what the problem is, and by the words out of your own mouth. For you to do contrary to what Panhandle Health District did with the vaccine would jeopardize federal funding. And for a man to make a decision of what's right and wrong based on dollars is a despicable thing for me. Unexcusable. That's my opinion. And then Panhandle Health District asked us 5 counties to come together and take taxpayer money and fund a facility that has done that much harm and damage to the 5 northern counties. Makes me want to throw up. I do not trust Panhandle Health District, I do not trust anything they do. Trust is something that is gained and earned. And I don't know what y'all will do to try to re-earn that trust. But when we look at the medical facts of how the health districts behaved through this whole pandemic, knowing the truth, without excuse they knew. If I had the information and understood it, there is no reason for a doctor not to know it and understand it. And we can't ignore the facts of what's going on. I want to know how Panhandle Health District is going to regain that trust and make us 5 counties feel like we're doing what is best for our community with those tax dollars.
Are you asking me a question,
I am asking
Commissioner?
you a direct question.
Commissioner, I am an honest man. I always have been. I have always operated in the best of who I believe and on my values. I am a God-fearing man, just like you do, with 6 children and 14 grandchildren. I'm a church-going individual, and I love my God and I love my Savior with all of my heart. And for you to accuse me of causing loss of life for a fact that I would get federal dollars is very offensive to me as an individual. And in defense of all of our wonderful people at Panhandle Health District, I disagree with you wholeheartedly on your comment that there was no effort at all happening with any of our employees to just so that we would get federal dollars, we would inject somebody with a serum that would kill them. That is just deplorable for me to even think. I might add that I met weekly with all of the administrators of your local hospital, with physicians of your local hospital, and about this pandemic. I met with them every week. I found them to be honest, trustworthy, caring individuals. And to accuse them, members of your county, to accuse them of deliberately taking life for money is also very, very offensive. These are your constituents, commissioners. And to make that comment about them is also, I think, deplorable. And so I am not going to defend that as far as Panhandle Health District. What I do know is that we've done a lot. You're absolutely right. You know, the health district has taken a black eye regarding this whole pandemic. And I also agree that because it was so new and many, many changes happening, there were some mistakes made. We would not handle the pandemic the same that we did. And we have an extensive after action report to talk about those kinds of things. But nevertheless, we're doing whatever we can to build trust. And that's the one thing I agree with you on, that we do need to build trust within our counties. And it's why I meet every quarter with all of our commissioners to try to answer any questions that they have. We are creating programs that best serve the health needs of our program. And there's probably no one in all 5 counties that's happier that this pandemic is largely behind us than I am, so that we can do the excellent work that we do. And that's my comment. That's my answer to your question.
Director Duffy, I respect your efforts and I appreciate the hard place that you were in. I do agree a lot with Commissioner Bradshaw. However, to me, we can't change the past. But going forward, you and I had a discussion, it was actually an open meeting, about not pushing the vaccine for children, which I have not seen any evidence that Panhandle District did. So I would ask the same be done for the expectant mothers, that is not also encouraged, pushed, or anything. I would go one step further and say, if the health district chose not to offer this vaccine to expectant mothers, or even stop offering to children, what would that mean for the operation of the health district?
It would have little change in our operation. Honestly, there's been so very, very few. We haven't had any expectant mothers come in for the vaccine, and we're not even offering that vaccine currently. And when we get questions about that, we're referring those mothers to their doctors to talk to them about that. We're not going to get involved in something that new to certainly push it for or against it at this point. Again, I'm comfortable with what you just asked, commissioners, with the exception of just thinking about, are we taking away the choice of our citizens to decide what they want to do? And that's the only area that I have some concern about. But like I said, the amount of vaccine that we've given to children, and this is the children coming to us, or the parents coming to us asking for it. Obviously, it's not the children coming to us. The parents come, they want them to have it, have been so very, very few. They're getting those done with their pediatricians and their own providers, and not so much with the health district.
Okay. So is this something that the health board would need to rule on, or is this strictly in your purview?
No, the board, I'm at the whim of our Board of Health. They can make those decisions if they wish to do so. And ultimately, it's the commissioners, right? Because they are representing all of you. And no, they could definitely have that discussion and make that call.
Okay. So then I would make a request, and you can tell me the proper way to make a request, that this would be an action item on the July Board of Health meeting.
Yes, what we can do is I am the secretary of the Board of Health, so I am the one who decides what goes on that meeting, and we could put that on our agenda for our July meeting.
Okay, so you and I can talk about that later.
Yeah, I'd like to see specifically what you're looking, because I'm confident that with that on the agenda, that will bring a lot of public interest,
Okay.
For and against.
Sure.
Right? I think you'd be surprised the number of people that would have trouble with not having that option for their children.
Sure.
Not so much maybe for the pregnant women, because that is so new, but I think it's interesting for us, and I think you have to delineate what vaccine are we specifically talking about, the
Sure.
COVID-19 vaccine or the other vaccines that are provided to children here with the health district, which again is utilized by all five of our counties. But I encourage it to be on our agenda. I think if it's an item, it needs to be discussed, and then it needs to be voted on, and that'll decide what happens from that time forward.
Again, I appreciate the hard position that you've been in.
Thank you for understanding.
Thank you, Chairman.
So you were a medical doctor,
No, sir, never have been.
okay? So are you aware of what a risk-benefit analysis is on medicine and procedures?
Generally.
So you've been to the doctor, he explained to you he was gonna operate on your shoulder there and your muscle, and he probably went through some risk and some benefits, which is required by federal law, I believe.
I don't know the requirements of that.
And when you go and pick up a prescription at the pharmacy, you look at the risk and you go, wow, am I really that sick? Is this gonna help me or kill me, you know? But they have to provide you what those risks are. Before you went into surgery, the anesthesiologist had a form for you to sign, understanding that not everybody that gets put under wakes up. I've had that many times. That's a risk benefit. They tell you what the benefit is, they tell you what the risk is. Did Panhandle Health District offer that on any of the vaccines? Or any of the procedures that they provide?
I'm going to turn to Jenna a little bit. I believe we do. Jenna, can you answer
We
that
do,
with more
yeah. So
detail?
anytime somebody comes here for vaccines with questions on vaccines or any treatment, so for example, colposcopy, pap smears, anything that we would perform here, they are always having a discussion with the nurses in the room about what potential side effects are, screened for previous adverse reactions to those types of of vaccines or procedures, allergies, things that would make them a risk.
And that was done with COVID vaccine.
Yes, that would
Every
be done with,
time.
yes,
You
as well
provided a
as,
risk benefit analysis.
I guess I can't answer specifically because I don't know specifically what you're looking for. There would be a conversation with the person administering that vaccine about, as well as pre-paperwork completed, have you had an adverse reaction in the past? Do you have allergies to eggs? Do you have allergies to any ingredients in any of these vaccines? So there would be a conversation that would take place, as well as the patient completing that paperwork and signing a consent to receive.
Well, that would be odd because as far as I know, none of the vaccines were ever provided a risk benefit analysis.
So that would be.
Panhandle Health District had the opportunity to endorse legislation this last session that would require all health providers and health districts to provide a health risk benefit analysis for any procedure or medicines that they provide. But they chose not to endorse that. Why?
Well, that's once again an inaccurate statement, Commissioner.
No, it's not. It's 100% spot
May
on.
I finish?
You may.
So that was brought, Dr. Fletcher had, and that's the appropriate step that goes through that. He has the opportunity, any citizen has the opportunity to bring that to, if they want legislative change to happen, and I'm not an expert on this, granted, but they take that to a committee. The committee then reviews that, either a House committee reviews that, and it's determined whether it's going to even get to a vote. That was taken to the House committee, and they, for whatever reason, and I don't think it was so much against what the hope of the legislation was, but the process of implementing that, they chose not to hear that. And so it never even got to a vote. It never got to the Senate to even approve. The Idaho Association of Counties, which represents you and all of you here, voted that they did not support that legislation. And that's where that happened. As a health district, I never had the opportunity to endorse or vote for or against that in any way, shape, or form. That's not how that legislation moves through. If it needs to go through legislation and to becomes law, and then the health districts are required to follow that. But I never had the opportunity to input on that at all, Commissioner.
Dr.
Yes, Mr.
Fletcher, would
Chairman.
you like to ask a question or comment on
Mr.
that?
Chairman, I'd like to make a comment.
Okay.
When the pandemic started, it was, the whole world was in no man's land. A lot of mistakes were made. Some good decisions were made. I know when it came to the mask mandate, I thought Panhandle Health did a fairly decent job of the mandates staying, 6 feet away only, and it wasn't forced on us like it was in some other parts of the state, some other parts of the country and world. I think we've gotten a little bit off of the subject here as a proposed budget for fiscal year 2024. I think we should, if you want to continue down this path, have this discussion at a regular board meeting. And I would like to get back on the task here of the proposed budget for fiscal year 2024 and discuss issues with the budget itself. We can rehash the past till the cows come home or some place freezes over, but I don't think it's going to solve the 2024 budget discussion. So I'd like to move on and move forward with the 2024 budget if we can.
Well, being that he's asking all 5 counties to support him and fund him, and that's what we're here for, is the budget. I think the public has a right to know what they're getting for their dollar. So, Dr. Fletcher, did you have something you wanted to comment on or question you'd like to ask?
Well, yes and no. Frankly, I kind of agree with your position there. There's a time and place for everything.
I'm sorry, Dr. Fletcher, can you just push your microphone button?
Oh, yes, I'm sorry.
It's okay.
I apologize.
Thank you.
Push the little button so it turns green. There you go.
Oh, thank you. I needed that. I'm a novice at these things. Um, Efforts have been made to have an adult conversation at the board level regarding risk-benefit analysis of the vaccines. Adequate time to address those issues during a board meeting were denied. If that is to your approval, then so be it. 100% of the guidelines followed by the health district are in concert with CDC or one of its derivative organizations. That is to say, there is no independent assessment of the risk-benefit analysis by this board, or for that matter, well, by this board. District 4 actually conducts its own risk-benefit analysis, but certainly not District 1. I think that's sad. I think if we're going to be on a board and we're going to pretend to be acting in the best interest of the public, we should be invited, called upon to assess risk-benefit analysis. And that has not happened.
So,
You know,
just real quick, state what your qualifications in the medical field might be.
well, I'm a retired physician. Curiously, I had requested if there was a possibility that I could audit the data collected by the Panhandle Health Vaccination Program. And Mr. Duffy said that it was not in my purview as a board member to assess that data. Prior to saying that, he said, well, you don't have the qualifications to assess that data. Mr. Duffy doesn't realize I actually have a background in mathematics. That was my degree. And even more particularly, I did a thesis, a senior thesis on Bayesian probability theory. So actually, contrary to what he doesn't know, I have a very suitable background to assess public health data. And I have a history of doing as much. But I was disinvited because I'm a board member from assessing that. I know this is a budget meeting, but efforts have been made to try to get to the bottom of the administration of public health, and they have been thwarted. Know that. And as for pregnant women, an absolutely unprecedented vaccine program is going to be launched later this summer. The respiratory syncytial virus gene-based vaccine platform has been approved by the FDA to give to women in the second half of their pregnancy. You're going to be giving pregnant women a gene-based vaccine so that their children can acquire, the unborn baby can acquire passive immunity to RSV, respiratory syncytial virus. Do you know how many children die of RSV in the United States last year? 25, sir, 25. The limited data predicated on about 5,000 patients showed that it will take 200 vaccinations to prevent one RSV infection in a pediatric patient. 200. 200 people have to be vaccinated just to prevent one infection. The study was not powered sufficient to know how many would have to be vaccinated to save a life, because there are so few that die from it. You would need 100,000, a randomized control study of 100,000 patients to pick up enough signal to answer that question. So even the randomized trial is insufficiently powered to ask how many lives you will save. In the meantime, the very data of the pharmaceutical study shows that you will incur a premature delivery of prior to 37 weeks of 1 in 100 vaccinations, and you will incur a premature delivery of smaller than 32 weeks in 1 in 400. So you're going to be inducing premature deliveries to prevent 1 in 200 RSV infections.
Why would anybody take the vaccination then with those kind of statistics?
Thank you, sir. Why would the FDA approve that?
Yeah,
Thank
yeah,
you,
yeah,
sir.
that's what I mean, yeah.
Thank you. Can I stand up and shake your hand?
Well, I'll catch you later.
But why has that discussion not occurred in this room? And that's the question you were asking. And I want to thank you. You're a saint.
Hardly,
I think
trust me. No, that's why.
There needs to be an adult conversation. Now, you're right, sir. It's not a budgetary issue. You're right. But this is
Yeah,
public
I
health.
mean, on this particular vaccination you're just describing, it makes no sense to even administer or even approve it with those kind of numbers.
Amen. Thank you, sir. Amen.
So, Mr. Chairman, and I have to go back to Commissioner Lambert's, it's not on our agenda, so I want to appreciate all the discussion that's happened, and I want to encourage more getting on the agenda for July, and we'll have new board members by then. And so I do want to encourage that discussion. Did you ask the Board of Health to give you access to this data that you're talking about? Or was it just through Director Duffy?
I asked for time. I asked to make a presentation.
Okay.
And I was told the only time that would be allotted to me would be 3 minutes under public hearing, that I could not make a formal presentation on board time.
So I will actually speak to Director Duffy and we'll get some clarification in that matter. But I would ask Chairman to call for a motion for the budget at this time.
I struggle with the 5 counties paying for what we're not getting. I really do. And hearing that you have a retired surgeon, not just a general practitioner, the interventional radiologist that was featured in the radiology journal multiple times in his career as one of the top surgeons on planet Earth. And you won't give him but 3 minutes to make a presentation on something that affects what you do for the public is asinine at best. It really is. It blows my mind, the reasoning behind that. There's no words that you can say that excuses that kind of behavior. None
Commissioner,
whatsoever.
if you're
Don't
going to
interrupt me.
continue
I'm running this meeting.
attack me, then
I'm chairing this meeting.
I'm
Do
done
not
with this.
interrupt.
Then I'm done with this meeting.
Well, you can walk out if you want to, but we're not done. So I encourage the 5 counties to take a look at what you're paying for. This is your director. I don't know how you all go about choosing a director, if he's voted in, if he's hired or what, but that should give you a clue as to what's wrong with Panhandle Health District right there. I will call for a motion to approve the budget or deny the budget, whichever you want to do.
I'll make a motion to approve the budget.
I'll second that motion.
All in favor?
Aye. Is there
Aye.
a roll call vote?
Roll call vote?
Benoit County,
Yes.
Boundary County,
Yes.
Kootenai County,
Yes.
and Bonner County.
No.
Actually, Panhandle Health is a lot more than just COVID vaccine or
It is.
COVID.
It is.
And we're trying to move forward with health and safety for restaurants, food service, septic systems, making sure young women and children are protected in the community. And if there's sins of the past, we should, that should be discussed at a regular board meeting and try to make a pathway to the future that works to, for the benefit of the health of North Idaho. And I think that's what we're trying to do here today.
Yeah, and I appreciate the comments, and I plan on working with Director Duffy to get some of these discussions on the Board of Health agenda and out in the open.
Well, you have my support.
I only come to one meeting a year, that's this one, to approve the budget. And Marlo is our representative from Benoit County for most of the time.
Well, I would encourage all the commissioners of all 5 counties to come and hear the presentation that I certainly hope that this district would put on and allow him to present. And here's my take. If my next door neighbor is a community leader, volunteers for all the good stuff, helps people, somebody gets hurt, goes and chops their wood for them, best guy in the community for 25 years, greatest neighbor on planet Earth, and then he harms a child. Does all that 25 years of being good count now? Or if he walks into the bank and robs it?
We're getting
What
way into the
what have we
weeds.
done?
Way into
And
the weeds.
no,
about housing.
I'm going someplace. Panhandle Health District provides a lot of very necessary and good services. But when they do something that is so deplorable, do they realize the damage that you're doing to what you do that is good?
Mr. Chairman,
I mean, really?
I make a motion we adjourn.
Second.
It is 11:43, and we will adjourn this meeting. Give or take a minute. And that's why life goes on the way it does, because nobody wants to hear the truth. But